terms of the actual medicine session itself, I think, first of all, it's probably very important that the therapist have their own medicine experience, because without a sense of non-ordinary states of consciousness, it's going to be, I would think, quite difficult to guide the person through these experiences. So I think having your own experience puts you in a much better position. And I probably wouldn't entertain the idea if I hadn't had my own. Going into the experience, one of the things that I think is really important to discuss is music, and to consider. I think music is a really critical element of these processes. So it takes really thoughtful consideration. And I think the music has to have an element of the sacred to it, I would say. But then having said that, that can be tricky too. Because I learned from experience that some patients can be really, truly triggered by music that may, for example, have any religious overtones to it. And so it's worthwhile really exploring the patient's emotional reactions to music and their philosophical and spiritual positions and comfort level and discomfort level. Touch is, of course, really, really important, as I'm sure you've already been taught. And what ends up being really important is having a explicit conversation about that preceding the session, and finding out just what the individual's comfort level is. Letting them know that you're there to offer a hand if wanted or needed, but finding out if they're distressed. Are they comfortable to be touched on the foot or the shoulder, or in some cases, do they even want to be hugged if the circumstances are appropriate? And having that conversation, I think, is very facilitative of the entire process. It really puts the person and the therapist at ease. And then in terms of the actual process, I think you have to really be wide open, because you really don't know what you're going to see, what you're going to get. There have been times where on the surface, the entire process has been quiet, tranquil, or even boring. And there have been times where during the medicine journey, the patient may even be snoring away. And then there's other times where they've been percolating with activity and emotions and wanting to talk, wanting to take their eye shades off and sit up and engage, in which case most of the time your default position is to try to encourage them back into their process. But I think the most important element of sitting is mindfulness, mindful awareness, this intention, prayerful, meditative kind of attitude, and learning to try to resonate with the patient's experience, again, without interfering more than absolutely necessary. Other aspects that I've found interesting and are worth talking about would be involvement of the spouse or partner or family. And we have consistently offered to have a family member present throughout the entire session, if that's what the patient is comfortable with. But there's no incident where any patient has actually asked for that. Sometimes the patient have a loved one come in with them at the beginning of the session, which is often helpful. Then they'll leave, and generally speaking, somebody will come back for what I call the kind of twilight of the session, where they're coming back into ordinary consciousness, but their mind is wide open and their hearts are wide open. And this is generally the most active part of the session for the sitter or the therapist. But it's also probably the most beautiful part, because the interactions that you'll see people having with their loved ones often are of a honesty and openness and intensity that even they've never had before. So it can be a particularly beautiful part of the session. And the other thing that I've kind of learned from experience is that one of the things that one of the parts of the journey where I've often found I'm the most active is when you start to see obsessive mind come back into the frame, whereas the patient had a break from obsessive mind, sometimes a break that they've never had before, and then with the open heart and the swelling emotions, and then the rational mind wants to come in and start explaining it and talking about it and speculating about it, all of which is fine, but interferes in the process. So at those times, I often find that I put in a fair bit of encouragement for them to be aware of that egoic mind, but just let it be for a while and try to sit in a more heart-centered place. So those would be some of my experiences of sitting with the client.